Hello, let's talk today about keratoconus and also the surgical treatment of this condition. Keratoconus is a disease affecting the cornea. The cornea is the outermost structure of the eye. In the average cornea, it has a uniform shape or curvature. For those with keratoconus, the cornea loses its uniform shape and starts to become more pointed, like the point of an egg or the point of a football. It also thins and weakens over time. The unfortunate thing about keratoconus is it does lead to progressive loss of vision, meaning that over time, as the structure changes and worsens, the vision does tend to change and worsen. Patients in early stages of keratoconus can generally wear glasses to provide adequate vision, but soon after this, as it progresses into more advanced stages, glasses are no longer able to correct the vision adequately, and patients then need to wear specialty made contact lenses for their unique situation to correct the vision. If it's allowed to progress unchecked, the cornea can eventually experience severe distortion, which can cause scarring, and then in some cases requires the need to be completely replaced with a cornea transplantation. Our goal is to try to prevent your cornea from ever reaching that stage. We do offer 2 procedures that are designed to help with this. It is very important to note that these procedures are not designed to correct the vision. Unfortunately, there are no safe vision correction options currently for patients with keratoconus. So after surgery, vision correction in the form of glasses, or more commonly specialty contact lenses, will still be necessary. However, the goal is to prevent further shape change and worsening of the vision. If these conditions are left unchecked, unfortunately, like we discussed, the vision does tend to worsen over time. A closely related condition is broadly called corneal ectasia, which is just a loss of the normal structure of the eye from conditions other than keratoconus. This is a rare side effect of certain surgeries like LASIK, or can be from other related conditions like pellucid marginal degeneration. These procedures can also be used to treat this condition. For patients beyond the mild stage of keratoconus, we do recommend a procedure called Intacs. It's a procedure that's done in the office. We place small, clear ring segments into the cornea. These ring segments help to lift and flatten the cornea, reducing some of the irregularity and astigmatism associated with the condition. They also are believed to hold the cornea in a stronger position over time, so reducing the likelihood of worsening of the condition. The procedure itself is done in the office, taking no more than 20 minutes. It's a fast procedure, and prior to the surgery, patients can take a mild sedative to help them relax. It's then done with eye drops that numb the eye, so it's completely pain-free. A surgeon uses an instrument to create some small channels in the cornea. We prefer to do this with a laser. We then insert the ring segments, either 1 or 2 segments based on the shape of the eye and other parameters like the prescription, into the cornea. The procedure itself is fast, and the incision used for the surgery is very small, less than 1 millimeter. It heals up almost the next day. So most patients can resume most activities the next day. Patients can generally continue to wear their current glasses or current contacts after the surgery, but it is important to note that as the Intacs do change the shape of the eye, the glasses and contacts will not correct the vision in the same level, and sometimes the current contacts will not fit the eye appropriately or will not correct the vision adequately. This can make for a period of difficult and blurry vision during the healing period. For this reason, we generally perform this surgery on one eye, for instance, the right eye first, and then we'll perform the next step, which is the cross-linking on the same eye. For patients with more mild conditions, we do skip right over the intacs and go directly to the cross-linking, which is the next step. Cross-linking is a procedure that's designed to freeze the cornea in its current position. It's been used in Europe for over 20 years, and most patients who have cross-linking performed show no further change in the shape over the eye. So unlike intacs, which is designed to slightly improve the shape, the cross-linking is actually designed to freeze the shape in its current position. The disadvantage of this procedure is, unfortunately, it does have a very prolonged recovery, both in comfort and vision. The procedure, though, is done just down the hall. You can take a mild sedative before, and then it's done with drops that numb the eye. It is a lengthy procedure, on average taking about 2 hours in the office. Step 1 of the procedure is the surgeon uses an instrument to remove the cells on the outer cornea called the epithelium. We generally prefer to do this with a laser. We then apply vitamin B drops called riboflavin to the cornea. They're applied very frequently over a half-hour period. After the cornea has been fully soaked or saturated with the riboflavin or vitamin B, a UV light is then applied to the cornea. It's a very boring process. A patient just has to stare ahead at a light, and more eye drops are applied during this process. That process takes a half hour as well. After this, a clear protective lens is placed on the eye, and the patient is able to go home. The day of the surgery, the eye will be quite uncomfortable. The eye will be very red, and the vision will be very cloudy. Unfortunately, there are 3 to 5 days of discomfort associated with the recovery from this procedure. During this recovery, we do prescribe pain medication, but unfortunately, patients should expect that for 3 to 5 days, they will be in a fairly major level of discomfort and need to take it very easy. We do advise patients to stay at home, certainly will not be able to work or drive for 3 to 5 days. We will see patients back in the recovery period. Some patients we see back 3 to 5 days to remove the contact lens. Some patients we may apply additional contact lens called an amniotic contact lens to help promote healing and reduce scar tissue, particularly for patients that may have pre-existing scarring. That's on a case-by-case basis, but do know you will have to follow up within 3 to 7 days, sometimes sooner. Eye drops are necessary during the recovery period, generally on 2 eye drops while the contact is on the eye, and then a course of eye drops for about 6 weeks after the contact is removed. Fortunately, the comfort does recover by about 3 to 5 days. The eye should be comfortable, but the vision will be cloudy during the recovery period. Full and final vision recovery can take up to 2 to 3 months. During this time, unfortunately, like we had discussed before, the current form of vision correction, be that glasses or contacts, is not going to work the same. This can make for a very frustrating period for patients where the vision is quite cloudy. Just know that the long-term benefits of this surgery do outweigh the short-term inconvenience, which can be very significant once again as the vision does change through the recovery process. However, after the 2 to 3 months, most patients are able to then be either refit into a new updated glasses prescription or a new updated contact prescription, generally specialty fit contact lenses. Specialty fit contact lenses are able to correct for irregularity associated with the condition, specifically irregular astigmatism, and ultimately provide vision clarity that generally surpasses that of glasses. It is important to note that our office does not fit specialty contact lenses, so we will either have to return you back to the doctor who sent you to our office or connect you to a local doctor in the community to help with those contact lens services. Ultimately, the end goal, once again, for those with keratoconus or corneal ectasia is that we do perform these surgeries with the goal of delaying any further progression of the condition that can lead to progressive vision loss and scarring. The procedures do have a very high success rate. They are safe and both FDA approved procedures designed at achieving this goal. Very important to know that they do not correct the vision in any way, and they do change the vision, so the vision correction will need to be changed after the procedure. Just like any procedure, these do have some side effects associated with them. The number one side effect of these procedures is temporary dry eye. The eyes do tend to be dry for 3 to 6 months after surgery. The use of some eye drops will help with this, over-the-counter eye drops. We can also employ other methods to help reduce dryness. Prior to the procedure, we do offer what we call an ocular surface package. It's a 2-step process that's designed to promote the best quality tear production naturally. Step 1 is a gentle cleaning of the eyelids and eyelashes that help remove some of the excess debris and bacteria from the eyelids. It helps the eyes naturally produce healthier tears over time. It's a safe, gentle 15-minute procedure in the office. Step 2 is a warming and massage of some glands in the eyelids called the meibomian glands. These help produce the oil part of our tears, and by having this procedure done, it helps the eyes produce naturally healthier tears over time. The effects of this procedure have been shown to last up to several years. We do also have the option of using a tear blocker in the tear drain. That'll keep more of the own body's moisture on the eye surface. These are called punctal plugs, and they could be applied after the surgery. The second side effect of these procedures are some glare and halo around lights. This may last typically 1 to 3 months. Most patients do have a full resolution of this over time. Any procedure like this does have a small chance of what's called scar or haze formation. Generally, if this occurs, it's very mild and it does not affect the vision. In some circumstances, it can temporarily affect the vision, but fortunately, it does generally fade or reduce over time. There's always a very, very small chance of other things like an infection or other problems that could arise. Those are very rare, and if they were to happen, can generally be treated effectively. Finally, just to reiterate once again, these procedures are not designed in any way to correct the vision, so vision correction will still be necessary in the form of glasses or contact lenses. The last thing I would like to leave you with is, once again, we generally do the more severe affected eye first for both procedures if indicated, and then the less severe eye second. Some patients do choose to have new contact lenses or glasses made for the first eye treated prior to treating the second eye. So they do have a period of clearer vision prior to proceeding with the second eye. Though everyone does have to make a decision about their own occupation, lifestyle during this healing period to help make the best decisions. Finally, once again, the combination of the intacs and cross-linking are an effective standard that's actually used throughout the world for patients with with conditions beyond the mild stage. If your condition is in the more mild stage, we may recommend only the cross-linking to be performed. Okay? But once again, these are very exciting treatment options. They're both FDA approved. We are very happy to be able to offer these in our office. The cross-linking has been FDA approved for several years now, but fortunately, it's something we can offer. Prior to that, we unfortunately weren't able to. We're happy to answer any questions you may have. Certainly let us know. The next step in this process is we have to submit this to your insurance. So they do review your records, make sure you're eligible for this procedure. That process can take several weeks or several months, but we're certainly happy to answer any questions you may have through that process.